I see a few more people are joining. Just going to give a few more minutes. Thank you. All right. Well, welcome everyone, and thank you for joining us today for another Wednesday webinar hosted by the National Bleeding Disorders Foundation. My name is Kyla Clark, and I will be your host today. This webinar is being recorded to ensure accessibility for all and will be available on NBDF's YouTube channel and bleeding.org immediately following today's webinar. If you have any questions during the webinar, please ask at any time through the Q&A chat located at the bottom of your screen. Or you can also comment on our live stream on Facebook and LinkedIn. Now, we all know that wildfires have been has long been a reality in California. But in recent years, their intensity and frequency has reached alarming levels. The recent Los Angeles fires has displaced thousands of people, destroyed homes, and left a lasting scar on communities across the region. But also with these disasters, there's a critical story that often goes untold: the impact on those living with bleeding disorders. For individuals with hemophilia, von Willebrand disease, and other inheritable blood and bleeding disorders, a wildfire isn't just a natural disaster. It's a health emergency. Evacuations disrupt access to life-saving medication. Emergency rooms may be overwhelmed. The stress, the smoke, and the uncertainty can take a serious toll on both your physical and mental well-being. Today, we'll hear firsthand accounts from leaders within the bleeding disorders community who have lived and are assisting others through the LA wildfires. They will share insights on preparedness, on emergency planning, and resources available for those in our community facing future disasters. Today's conversation is about more than just survival. It's about resilience, it's about advocacy, and it's about ensuring that no one in our community is left behind when a disaster strikes. I am proud to introduce today's guests, who are actually more like family. Rigoberto Garcia, also known as Rigo. He is the executive director of the Hemophilia Foundation of Southern California, also known as HFSC. Rigo leads efforts to improve the quality of life and build a community for individuals with inherited blood and bleeding disorders. With over 18 years of experience in health education, leadership, and outreach, he is dedicated to ensuring marginalized groups have access to primary care. We also have Omar Torres, who serves as HFSC's Community Outreach and Engagement Office Coordinator, and is also a fellow blood brother. With a strong background in behavioral health and social services, Omar acts as a liaison connecting the Hemo SoCal community to HFSC programs and services. He collaborates with local hemophilia treatment centers and non-HTC partners to ensure access to care and critical resources. Omar's mission is to empower and uplift the blood and bleeding disorders community through education, advocacy, and compassionate support. Welcome, and thank you both for joining us today.
Thank you. Thank you for having us.
Absolutely. So I know that you mentioned and that you're located in Southern California. Can you tell us what it looks like when you got the notice about the wildfires and what life has been like since then?
Yeah, absolutely. So, again, my name is Rigo. One of the biggest things is that with Southern California, our chapter really covers the 9 Southern California counties. And so we're from Orange County, Riverside is our southern counties, all the way up to San Luis Obispo, Kern, and Inyo. So it's a very large area. But here in Southern California, we're used to where we call them the Santa Ana winds, and the those winds that come in, they usually come in inland out to sea, directly out to sea, which is usually the opposite of the way that our winds pass through Southern California. The difficulty is that these winds usually are 30, 40 miles per hour. And we get used to those. We know that those are coming. It's going to be a windy day. You got to be careful and whatnot. The thing that was very different this time around, and they were even advising us a week before, was that these Santa Ana winds that were going to take place at the beginning of January were going to be up to 100 miles per hour, which is very unheard of. And we haven't had winds like that in a very, very long time. So we were here in Southern California. I was in my home. I live in Hollywood. One of the fires did come about 3 miles to my home. Um, and it was a bit scary. It was a bit scary because we started to hear that a fire started in the Pacific Palisades, and the Pacific Palisades, they're kind of in I guess you would say a canyon that goes from a higher level where everything is at down to the sea, but it's at an incline, and so the winds are it's a perfect travel path to get out there, and with one small spark we were, just listening to the news early in the morning. Next thing you know, it's midday and people are trying to get out. They're leaving their cars and they're running down the street. Because that's the only way to get out. Um, then it was that after that evening, and we heard Altadena sparked a fire, and this was again around 6:30. Next thing you know, it's 7:30 and people are same thing running out by foot in the area. And so it was very scary in the sense that this happened very quickly. It was the perfect storm in regards to the winds that were taking place and the fire. And it was a small spark. They're still investigating it, but it was a small spark that just started everything. And the hardest part about it is that, we've had fires before. They're usually in the mountainous areas. They'll burn different areas, but it kind of burns in different directions. This one, it literally started at the top of Pacific Palisades, burned all of Pacific Palisades. So if you can think of a complete city destroyed, it that happened, and that didn't only happen in the Pacific Palisades, but it also happened in Altadena, where it started at the top of the hill and then just started racing straight down. So Altadena, so everybody kind of knows, is that when you see the Rose Parade and you see the floats passing by and it's on TV and you see the beautiful mountains behind it, that's where Altadena is. The foothills of those mountains is where Altadena is. And so really can't see it, but I've driven by it and it's a war zone. It's if someone just threw a bomb and everything is completely gone. So families had 20, 30 minutes to get out. A third fire that evening had started in the Hollywood Hills, that's around where we live, and we got a notice. It was an accidental notice that went out to everybody in Southern California, but it was one of those that you need to evacuate. And because the winds were so hard, we thought it's the embers that are flying and are now around our neighborhood. I mean, we got up, we didn't know what to do, and it was just to prepare to evacuate. It's like, what do you get? And we thought, my husband and I thought, well, grab our laptops, grab a pair of jeans, grab a sweater, let's put it in the car. You're in frantic mode. So a lot of these families had 30 minutes to get out and get out and be safe. So a lot of them left with just what they were wearing, and that's about it.
Wow, that had to be so hard. I can imagine the stress that you were under, just trying to figure out what to do in the little bit of time that you had when, you weren't expecting this. That had to be so difficult. Omar, do you live in the same area? Are you very far apart? How did you maneuver when you heard about the news?
Yeah, thank you so much. So, living in the Inland Empire, it's about 45 minutes to an hour and a half to Los Angeles, depending on traffic. So I was quite some distance away from the fire. Having said that, people who are unfamiliar with Southern California, once they hear something's going on in Southern California, they reach out to myself and my fellow friends and family who are within the Inland Empire, out of concern and making sure that we're okay. So definitely a lot of those conversations initially were like, "Hey, I'm okay. I'm some distance away, but thank you for reaching out." My next concern was definitely our community, making sure that those in the area were supported. As Rigo had mentioned, this happened in the evening, so we were kind of just monitoring throughout that evening, seeing how fast the fire was spreading. Indirectly, we started receiving those notifications from our electrical company stating that there is going to be to expect some type of outage happening within the next hour or so. Because trying to mitigate and prevent any further spread of the fire or any further sparks, just again, precautionary. So with that in mind, I started preparing myself, having those ice packs already in the fridge. As mentioned, as you mentioned, I'm a fellow blood brother, so medication, having to stay cool was of utmost importance to me. And honestly, as Rigo mentioned, kind of unfortunately for my case, it was disaster response instead of disaster preparedness. Kind of gathering those little supplies that I could have at that time, but definitely taking into account that it was more so a response rather than being prepared.
Wow. I'm just really glad both of you are okay. I know that had to be so hard. We have at least one staff member that is located in the California area, and just to hear them have to go and pick up their relatives that may have been a little closer to the fire, and just everyone joining in to help each other. But it was stress, like shared stress on everyone. It kind of felt as though it didn't matter if you were right next to the fire or you weren't. Everyone felt that same way, and just trying to frantically help each other and get themselves to safety too. So I'm really, really glad both of you are doing well and that your families are okay. Yeah, now you mentioned, Rigo, earlier in the conversation that about Altadena, and I know that's been a huge topic on the news, right? And I believe it's located in the Southern California area, just north of Pasadena. As you said, most people are familiar with it being on the high hill, beautiful location. I've been there before where everyone takes their pictures. Now, mind you, I would never walk up that hill, but it's beautiful. And I know that so many homes were destroyed and they're unrepairable. Given the significant impact that happened with the Altadena community, what challenges do you think they will face during the recovery process, and especially when it comes to healthcare access?
No, absolutely. I think one of the biggest things that kind of like what you said, whenever we hear north of, we feel that it's a much more affluent community. And that's one of those things. And Altadena is a very mixed population. One of the things that makes Altadena one of the great places, and why we're hearing so much about it is that Altadena was one of the cities that when many others were redlining, so that certain ethnic groups cannot purchase a home, Altadena kind of opened their city up. And many of the homes that were destroyed, unfortunately, were homes that were passed down generation to generation, and some of them have three generations, some of them have multi houses on the property, just because the properties are a bit bigger. And this is just so that again, communities that were unable to purchase homes was had that opportunity, which was one of the things that isn't being so much talked about. Excuse me. Um, in the news and whatnot. And I think one of the biggest things, even with healthcare, there was when a community clinic that did burn down in the area. And usually, again, community clinics usually are the ones that serve those that are underserved or uninsured or have Medicaid, if we want to kind of think about it that way. And so when we do think of Altadena, there are some areas that are very beautiful, and the whole city is beautiful itself. And I think that's one of the things that does make it um, that it doesn't have to be the socioeconomic levels of everybody very high to have a beautiful city. And that's kind of one of the difficulties now. Healthcare wise, I think that's one of the hard parts about it is that many of the community have lost the healthcare services where they're at, and they've been displaced. Many of them are displaced very far away. I mean, we have certain people who may be stepping down from a board, or maybe we've been hearing this, or don't know where to see their care because they moved down to a family member in San Diego, which is 3 hours, 3.5 hours away from Los Angeles. And so one of the biggest things that we're trying to see is as how many people are have been affected, more of the bleeding disorders community, and really working with our hemophilia treatment centers, and how can we be able to assist them?
No, that's well said. I know that I've seen, and as you said, many people had different levels of healthcare that they're provided, or they may have different disorders that they are trying to manage and thrive. I'd love to know and hear more about your organization and the work that you do on a consistent basis before the wildfires, but also the support that you're giving through the wildfires and how you have been able to work with these different community members to provide that support, or what kind of questions you received to date.
Yeah, for the first part, so we're the Hemophilia Foundation of Southern California. We're one of the larger, more diverse foundations across the nation. We've been around for 70 years or 71 years. We just celebrated our 70th anniversary last year. We serve over 3,800 community members. And one of the biggest things is that, a lot of the programming that we do is making sure that we're complementing and we're serving all of the communities, and all of the backgrounds that we come from. We co-host with our other California chapters the largest all Spanish conference in the nation, Familia de Sangre, which is a fully Spanish. We have this last year we had a record-breaking 700 community members attend. With everybody else in attendance, we're almost at 900, but 700 were community members, which is one of the largest events across the nation, in regards with just community members attending. So we're really happy about that, and a lot of the programming that we do. Recently, we focused on healthcare while Black, and how the Black community and the African American community have difficulty trying to receive care. So one of the biggest things that with a lot of the programming that we do is very diverse, which is very great for the community, and we're trying to see how can we meet the needs. And that's one of the things that we were really doing as we were getting ready for 2025. Our programming was, again, looking very diverse, looking for the young adults, a women's retreat that we have coming up. But one of the things that we've been seeing, not only with the fires, but then everything else happening, is the difficulty to try to continue to um, focus on some of our programming, because even some of our funding has gone to the wildfire relief, as opposed to some of the programs, and that's where we feel a little guilty from that, because how do you ask for funding for an event that's really important, but then you see your neighbor, without a home. Luckily, one of the things is that we have had um, funding take place. We had the Hemophilia Alliance, who did send some money. We had the other national the Hemophilia Federation of America sent us some wildfire relief as well, directly, where we could use. And they told us, if you need behavioral health support, or if you need whatever support you do, one of the things that we want to focus on, because we do know that there is a lot of assistance out there, is be able to focus, can we, or how can we, I guess we're saying, because we're building the plane as we fly it through all of this, is assisting our community members with healthcare and more of that aspect of it, either purchasing supplies, purchasing medications. I just met with one of the treatment centers, one of the medical directors, and she's like, I forgot that I sent them home with medication, and they have no supplies to be able to administer the factor. And so that's some of the things that we want to be able to assist with from that perspective, and be more on the healthcare side. In regards with some of the changes and phone calls, I mean, Omar could jump in a little bit with some of that information in regards with the fires.
Yeah, definitely. Thank you, Rigo. I think as Rigo had mentioned, it's definitely a multifaceted approach. Understanding that there's basic needs that our community need. So we're working with that lens as well. We're reaching out. We're thankful for our nonprofit community partners who have lent a hand, who have shared the resources with us. We're definitely working together and collaboratively, to provide that support in those other areas of need, ensuring that their basic care is established. Rigo had mentioned the HTCs. We're also really, really proud and really grateful of even our young community members who were advocates in the younger age, doing programs like the leadership program through the Hemophilia Council of California, who have grown now into work in Congress or work with legislators. We have a community member who is a legal aid at the California Assembly, and he's been sharing many resources, not just legal support, but also what future programs our communities can apply for to help them rebuild overall. So we're really grateful for all the support we've been getting. And again, we're just trying to share as much resources as we can. We've been able to update our list as we go along to establish the different areas of care, whether that's transportation, housing, food assistance, childcare, pet support. You know, those areas. We're trying to make sure that we get as much support and much resources to our community as possible.
Well, I think that's amazing. I mean, even down to the detail of you thinking of people's pets. Like, you all are awesome. And we so appreciate all of the efforts that you put into the community because, it truly takes all of us to work together. Everyone can't be everywhere at the same time, right? And I am so appreciative of the value that you all bring just for knowing the California area and the needs of the community members. I know it can't be easy, especially with so many changes that we have right now with funding. And I know I'm not we don't have it in the chat, but you're able to visit hemosocal.org, HEMOSOCAL.org, if you want to give to support the Southern California community and especially the work that Rigo and Omar do. Please feel free to visit that website and donate to help. And you're also welcome to volunteer. I'm sure they are accepting volunteers as well, right? You mentioned about advocacy, which is so key with a lot of the changes that we have within the government right now, and just trying to help new members that we have to understand the needs of the bleeding and blood disorders community, right? We have one of our largest events coming up, advocacy events in Washington, D.C., the Washington Days, hosted by the National Bleeding Disorders Foundation from March 5th to March 7th. Do you anticipate, or can you share more about what advocacy needs that you see within the Southern California community, and what you would need from elected leaders to help you to navigate this space and what you're thriving through and enduring right now?
Absolutely. I think one of the big ones is medication. Many of our community members and now kind of even broadening it beyond just Southern California's, but many other areas who have been affected by a natural disaster. I think one of the biggest things that we need to advocate for our elected officials is the access to medication. One of the things that is difficult to think of, that as you're running out, yes, you want to say like, yes, I want to grab my medication, or I'm gonna have this or whatnot, or even with my family, we've talked about it, like, what are you gonna grab? And people say pictures or this or that or the other, but one of the biggest things is the family and making sure that the family is safe. And when you're hearing that the main artery to get out of the area you're at is blocked, it's clogged, you're going to try to do whatever you can, and everything else is going to be left behind. One of the things that we would say with advocacy when I talk about access to medication is, many times, many of our community members are on Medicaid or Medicare. And I apologize, here in California, we call it Medi-Cal because we're special. And so if you hear me saying that, it's Medicaid. But recently, there was, uh, um, I guess you would say, like a policy that took place that anyone who was on Medi-Cal who needs medication to be allowed to get that medication, even if they just received it, if that makes sense. I just want to make sure that our bleeding disorders community is within that, and it's not by no means putting anybody down, but diabetes medication, which might cost $200 compared to a bleeding disorders medication, which could cost $7,000, and making sure that when we're talking about this allowance is that it's counting the bleeding disorders community. And so when we're looking at policy, I think this is one of the things that we need to keep in mind. And this isn't a political thing, this isn't a right or a left thing, but I feel that, there are many natural disasters that take place. It be hurricanes, it be tornadoes, it be, when things that are unexpected and states freeze over, and you may lose this or that. Omar talked about it earlier, but when we have these Santa Ana winds, they're letting us know we're going to turn off the power. And one of the things that we need to think of is, how do we prepare for that? And we put out a notice that, if you are getting the winds are coming, put ice packs in your freezer so that you can keep your medication cool. And, as we were talking about it with the team, they're like, oh, we didn't think about that. That was just me, my public health background coming out, stating this is what I'm thinking of, prevention. Because again, that's where I come from. But when we're thinking about this, there are so many things to think of. Um, and so when we're talking about, bringing it back to advocacy, I think that's one of the main things is medication access. And I know that there's a lot of things that we're talking about. We're talking about, the copay accumulators. We're talking about, making sure that our programs are safe, such as Medicaid, or any other assistance for medication. But when I need it today or when I need it tomorrow, especially someone who's lived through a natural disaster, how can we make sure that that population is taken care of?
No, it's so important. And like you said, this is about healthcare. It's much bigger than just politics because it
Right.
affects everyone. And I was definitely grateful for you. We worked together during the height of the LA wildfires, and I know it was difficult because you were trying to help so many people, both of you. But we were able to put together resources that we have on our news channel to provide it, and work together to update those resources so that people can find them in multiple places. I did notice as I searched, and that we searched as a team to try to find these resources. They might have been everywhere, but I was glad that people were sending them out. The governor, of California and different departments within California that were trying to provide those resources. There were companies that stepped up, like Uber or Lyft, that
Mhm.
also gave people free rides if they needed to get to a shelter. So it really took everyone. And I just want to thank you for taking out that time to work with us so that we could help provide, those resources to the community members. That is still on our website under our news channel if you ever needed to look back at that. But I think that's amazing to lead into because it goes back to your social media pages. Even during the disaster, I saw that you were posting on an ongoing basis. And I don't even know if you were like driving or if you were at a friend's house, but you were providing these resources on how people can put together preparedness kits or what they should bring with them if they have time to pack things up. Would you like to share more about what you'd recommend to others from what you've learned during the wildfires on what they can prepare for a natural disaster?
Absolutely. And one of the things, I'll pass this over to Omar and he can explain a little more, but I will say that, I have an amazing team that does all of this. And it takes a village. I have, four amazing staff members, Laura, Michelle, Casey, and Omar, who really, when all of this was happening, we were getting bombarded with information. And it's like, okay, how do we simplify the message? And again, being a health educator, I work with education and educational materials, and it's like, how do we simplify, how do we make it easy? And when we were trying to put these, it's like, okay, social media, let's start there, and when we were even making sure that we align. And this is one of the biggest things. It's like when we saw that the National Bleeding Disorders Foundation had posted some of the information, which was great. It's sharing of resources. That's one of the biggest things. But when we saw that you put it in your newsroom, we also did the same and put it in our newsroom so that it's consistent, and people can find it in the same areas. And that was one of our biggest things is how do we make it easy? How do we make it consistent? And NBDF made an amazing email with all the information and resources, and we were happy about that. And so we're like, okay, let's make sure we're copying that. So again, there's continuity. In regards to the information, a lot of the information that we were getting, it was through phone calls, emails that we were getting through our governor. We're getting through, Governor Newsom or City Mayor Karen Bass. It was just really, how do we create something and create something that's going to be beneficial and not overwhelm our community? And that's where we were just funneling everything to Omar. And I'll hand it over to Omar because he was the one that was creating a lot of it from what we were sending. We'd review it, but then we'd post it, and we were trying to do it as quickly as possible.
Yeah, thank you, Rigo. Let's first answer your question. Thankfully, I was able to borrow my father's generator, gas generator, so I was able to keep the electricity going. That helped a lot. But as mentioned at the beginning, not being directly impacted with the wildfires, being in an empire, wanted to make sure that we were able to, I was able to do my part as much as we could, based on the circumstances, and that this was kind of my way of trying to support as much as I could at that time. So with that said, obtaining information from different outlets and information from our community, from our nonprofit partners that we currently have established, from our HTCs, and as Rigo mentioned, making sure it's concise and available for our community, being social media, Instagram, Facebook. What's also great is that many of our community members have our direct personal line. We use that. Some of us work from home. So with that, understanding that our office line at our office was down. Our office is based in Pasadena, and understanding that if someone tried to contact the office, there was one, no one there, and then two, it wasn't being directed back to us. So it was great that it is great that many of our community members have our personal cell numbers, and we always give it out, and we always ask them to just text us, call us at any time. It doesn't matter. We're here to help. We're all family here, so having that established relationship definitely helps. But with that, we posted a very basic emergency plan. First and foremost is find your nearest evacuation center near you. It's a quick search. You can also we have a link directly to our website, so you can search your nearest evacuation center. We also encourage families to take pictures of the most important documents you may have. If preparing yourself for that, whether that's your driver's license, your passport, your social security card, your medical, your prescriptions, your will, your pet's registration, which is for many of our community members very important to them, pets of their family. The second is their go bag, and what's in that go bag. It's, as mentioned, our prescriptions, our ice packs, our our eyeglasses, I should say, extra car keys, a first aid kit, preferably like a power bank that's fully charged, and those non-perishable food items, granola bars, stuff like that. And then lastly, when you're told to evacuate, please evacuate. Your safety is our utmost importance, and we want to make sure that you're safe. So please grab your stuff and head home, and head out to the nearest shelter or nearest family or friends who could support. It's also very important to turn off your electricity, your gas. Can really make a big difference overall. And then when you do leave the home, reach out to a loved one, a friend, the foundation, just to let us know where you're at. That way we can account for you and make sure that you're okay throughout this journey.
No, those are great tips and, honestly helpful for anyone in any natural disaster. So I know for myself, I appreciate that you all posted those because I said, man, I don't think I even have an emergency preparedness kit, right? What would I do if something happened? Do I have everything kind of in the same place? Do I have something I can grab and just take and go? But yeah, no, these are great. And I'm so glad that people can still access that so that even today they can prepare that for themselves, their families, or their friends. Um, I am so glad that we're having this conversation, and again, I'm really happy to see that you all are okay, and that you weren't extremely affected. I know that in California you're still trying to work through things. I know that devastation takes time in order to fix that and to recover and to heal from that. Is there anything that you believe the bleeding disorders community members, but also companies, organizations, or anyone who wants to help can do to help support you all through this? Because I know it just hasn't ended when the fires ended. It's still something you're trying to recover from.
Yeah, I think one of the biggest things right now when it comes to anyone is any type of assistance. If you are in the Southern California area, there are a lot of organizations that are looking for volunteers, and volunteers to assist the burn areas. That's one of the big ones. I belong to a roundtable of executive directors. In Southern California. That's one of the things that that we've stated, if there's anyone that, manpower is, or woman power, or person power is what we need, and I think that's really important. That's really important to try to assist these families, and do what we can. That would be number one. Number two would be if there's anyone that wants to assist. We are taking donations, and like I said, any of the donations that are coming in from us are going to the medical aspect of assistance, and that's where we really want to try to focus. So that if someone does have um, difficulty trying to get factor, we could jump in and we can assist in that aspect, and that's not going to be a barrier. And luckily, like I said, we have some funds that if someone wants to come, we can go out and assist them in that perspective. And so that's where we're at right now. And I think one of the big ones also is that as we're looking at our bleeding disorders communities, just kind of bringing it back to that, is that we do want to continue providing high quality programming for our community. And that's been a little difficult right now. We know that, with the wildfires, it is a little difficult also to raise general funding. A couple of days ago, I was with the funder, and they are someone that does fund some of our programs, but it was very difficult to try to ask them for funding when we started the phone call. They were telling us that they directly were affected by the wildfire and lost their home. And so from that, as a nonprofit, we do feel guilty. And even talking to other executive directors in Southern California and in the Pasadena area, we feel guilty asking for funding to be able to continue programming, so that families can get through this. And I think one of the biggest things that we talk about is that when we're talking about trying to create programming and trying to continue this, we want to make sure that our families do feel welcome. We want to make sure that at our events, we're able to provide mental health services. We're able to just come together as a community and hug each other and whatnot. And so many times we talk about the people that lost their homes and the ones that were directly affected, but there are so many of our community members that may have been affected indirectly, and they might have they worked in the area, or had a business, or worked within one of the homes or whatnot. And so that's one of the things that we also have to think of, that it's not just the families that lost their homes, but those that indirectly were affected. And so that's where your assistance in any of the wildfire really, or any of our programming assistance would be wonderful.
No, yeah, and I'm glad you brought that up, because that was something that we also talked about. When you think about the wildfires and you think about when these type of natural disasters happen, you're thinking immediately of the homeowners, you're thinking immediately of the families, but there are so many other people when those stores are burned down, or when that person's home is burned down. If someone, worked within the home or provided services, all of a sudden that decreases their income as well, and they have to find new ways to find financial strength. So yes, I'm glad you brought that up, because that is also an aspect of those natural disasters that we as a community, when we come together, we can be so much stronger to understand what everyone else is going through. So I see that we have some questions. If you would love to be able to answer them. I see the first one, someone asked, did you find that the insurance or specialty pharmacies made any exceptions during the emergency to help people get treatment, or did you find that it was a little bit difficult?
We didn't connect with the specialty pharmacies. To be honest with you, we were kind of just working directly with Medi-Cal, because that was kind of the one that were holding the purse strings, if you really kind of do it. We did see that we have a state advocacy group as well that was focusing on that, and we saw that came down right away in regards with Medi-Cal assistance. One of the things that we hadn't heard was if any of our community members had any difficulty getting any of their medication. So that was one of the reasons we didn't reach out to specialty pharma. But that is a great point, and not trying to just skirt around the answer. It was that we don't know, to be honest with you, but it is something that we are going to be reaching out to specialty pharmas, and that will be a great question to ask if there's any assistance from their end or anything making it easier or difficult.
Thank you for that. We also have another question. Kenya asked, I've seen fundraisers for the people affected by the fires from celebrities. Are there ways for people affected in the bleeding disorders community to get access to funds?
Yes, so there are one of the biggest ones, like I said, I'm part of a executive director roundtable, and one of the larger foundations that is part of this is the Pasadena Community Foundation, and they've been the ones that have been receiving a lot of the funds and a lot of the sponsorship. And one of the things is that if you are affected, and there is a fire map and an app that one of the things we've been doing is that we've been going address by address and seeing, did a community member lose their home, because it will show a picture if a house is standing or not, unfortunately. And so that's one of the ways that we're taking a look. And we did find someone. We have found a couple of community members that were directly affected, but they're currently right now they're like, no, I'm good, and so we don't want to push. It's not that we don't want to give any of the money out, but we want to work with their timeline, and give them that grieving process as well, and not just, okay, this is what you need, because they don't know what they need right now, they are receiving assistance. So to answer your question, yes, there are receiving assistance, but we're not sure if all of those needs will be met, and so that's why we're still holding back. But luckily, we have the funds in the bank that we're able to assist.
And kind of just to add to Rigo's point, we are actively collaborating with our local officials as well. So once those programs do open within the government level, for families who may need to rebuild or requiring some legal support or any type of government assistance provided, we'll have those resources as well available through our website.
Thank you. No, that's really, really key. We have another question from Matt. I saw some fundraisers online for healthcare providers who lost their homes from HTCs. Is there a way the community can support them as well?
So we know that two actual nurses lost their homes that worked at an HTC, and there was a GoFundMe that was going around. And yes, you can you can assist them through that GoFundMe, and we'll make sure that we share that link with everyone, and we can put it on our website as well. So you can go directly with them, or if you'd like us, you can go through us as well and tell us like, hey, sending you a check, and you send this to them if that makes it easier for you, and we can make sure and show you proof that we're sending it to them. One of the biggest things is that we're fully transparent. We want to make sure that any of the funds that are sent to us go directly out. So even we have an emergency financial assistance program, but any funding that's coming in for wildfire is being earmarked directly for wildfire and will be open until all those funds run out. So that's going to go directly to people that are affected.
Thank you for that. So we have another question from John. Have you found that lived experience experts have a disaster plan for a secondary treatment center or an emergency plan at all?
I don't think that this is something that really comes up or that we prepare for. And I think it might be a great opportunity for all of us to do some training, especially for anyone that has lived experience. In Southern California, we are always preparing for a natural disaster, and and the natural disaster is usually an earthquake, never a fire. It's one of those, we have the great shakeout where we all get under our desk, and post pictures and whatnot. And that's where the go-to bag comes into play, having some of that food or having some medication or even a list of medication in there so that we know what's going on. If you have to run out, have it by, have it in your car, or have it somewhere where you can easily get to, just in case something happens with a fire. And sorry, with an earthquake. Well, when we started to think about this, it was really switching gears and how do we create something like this for um, something like a fire. But I think that even with the executive, across the nation, with other executive directors from bleeding disorders organizations, foundations like ours, we're talking about how can we have a training session for executive directors, because the East Coast got hit, with the hurricane, and the flooding that no one was expecting in cities that weren't supposed to be flooded, and what does that look like? How do we assist there? And talking to the South Carolina Foundation, it's like, yeah, we're literally going around providing checks for people so that they can, or cash, so that they can buy what they need, and it's as a collaborative executive directors, we're going to be having a retreat soon, and that's one of the topics that we're going to do a training on, with the various natural disasters we can think of, so that we can better provide better services for our community.
Yeah, I think too, as Rigo mentioned some great points. As we're talking, even I fell victim to this. It was more disaster response rather than disaster preparedness. Once, some disaster does come, that's when we all start, prepare. We're trying to gather as many materials as we can and understanding that we're cutting corners because we just don't have the resources in hand. Or we start overwhelming the system, whether that's the grocery store or the gas stations. So it not only just not as we're having this conversation, just continue on with this conversation and continue to implement and practice what disaster preparedness looks like, whether that's in the future events overall, but ensuring that we're practicing what we're preaching. And as mentioned, that comes from us as well.
Thank you. Thank you, Omar and Rigo. I think we have time to take one more question. What steps do you think that we can take as a community to advocate better for emergency preparedness plans that include people with bleeding and blood disorders?
I think one of the things that we can do is definitely know that our community has different needs, and different needs, not in a negative way, but again, our medication. And do we need to have those talks with the 340B pharmacies? Do we need to have a talk with the specialty pharmacies with that? Do we need to move that up to our elected officials? I don't know, in regards to, if this happens, where can I get my medication? And I think, I shouldn't have to think I need to go and run into the fridge, which may be in my garage, or the back room, to get my medication, as opposed to I need to grab my child and their bunny because they cannot sleep with it as I'm running out the house. And this is the reality of it. And if that's the case, am I going to have coverage for that? Because while I'm running out, I may have twisted my ankle, but you know what? With the adrenaline, I am not feeling it. Or I could have fallen, but I didn't even think about it, or I hit myself with the corner. There's so many things that I feel that with the bleeding disorders community that we need to focus on. And this may be something that, we really ask the community, what are your needs? And as an executive director, working with NBDF, how can we make sure that we create a collaborative, you know, emergency response, emergency preparedness list of things that we can definitely advocate. Again, not only to the elected officials, but do we bring this up to the Hemophilia Alliance to help us out with this? These are things and questions that are just coming up, and great questions, and please continue to ask them, because this is how we're able to move forward with the needs that the community wants, as opposed to, again, reacting to what we think the community needs.
No, that was so well said. At NBDF, we really believe that we're only stronger together. We value and we need that input and the expertise that you bring, especially being a part of the bleeding disorders community, but also understanding and being a lived experience expert. Because then when we create things, it's not just to have it so someone can download it, so they actually can use it in real time. And then it comes from a place where you've already been there and you experienced that natural disaster and you understood the rush that had to take place for you to get to safety, and what you had to think of in the midst of. So I think working together, I am delighted for us to be able to work collaboratively with you so that we can find a solution together and perhaps roll that out to other community members in other states, that they can come to us as a resource, but that they'll have somewhere to go if they need to find that information. So thank you both. I really appreciate it, and I know the community appreciates it. For everyone, remember that this webinar can be viewed on our NBDF YouTube channel. Also, be sure to visit bleeding.org, our new website name, and check the event section for upcoming events. Don't forget, you need to check the hemosocal.org. They have pertinent information, and they have valuable resources and opportunities for you to connect with the California community. So remember, you're not alone. We're in this together, and we have resources that you can find and take a part of. Also, don't forget to follow us on social media at NBDF Foundation, but also follow HemoSocal. They are very active on their social media channels. I know they're on Instagram and on Facebook. And also for NBDF, you can subscribe to our newsletter because we also share a lot of information and resources that you can find valuable. Finally, the key word of the day, so you can go and put in your name for that prize, which is an Apple AirTag, brand new with the NBDF logo on it, is California. So be sure to visit the NBDF social media pages to put your name in for that, and we will choose the winner and announce it tomorrow. Again, thank you, Rigo, and thank you, Omar. We really appreciate you being here today, and I hope to talk to you soon. Thanks, everybody, and take care. Have a great day.